Recently, I released a video where I talk about episcleritis. When I filmed the video, I was experiencing an episcleritis attack. In the video, I did not share my history I've had with episcleritis because I wanted the video to focus on simply episcleritis and not my history. However, people have commented that they did not believe I had episcleritis in the video, but rather a different medical condition called scleritis. To clear up any confusion, here is a very abbreviated history I have had with episcleritis to hopefully shed some light on this topic. When I was a small child, I developed a slightly swollen and painful eye. I was taken to a clinic. The doctor assumed because I was a young child, I had pink eye. I was given a prescription for an antibiotic eye drop. My mom dropped off the prescription at the pharmacy and we drove home. It took until evening to be able to get the medicine. I put the drop in my eye and went to sleep. The next day, my eye was normal. This routine happened to me 1 to 2 times a year. My eye would become red and swollen. I would go to the doctor and would be given a prescription for antibiotic eye drops, and my eye would clear up within 24 hours. Sometimes my eye would start to clear up on its own before I placed a single eye drop into my eye. Then one time I went to the clinic. The doctor said viral pink eye was going around. He was not giving any medicine for it. The physician said my eye would clear up on its own in 7 days. I was sent home without a prescription for antibiotic eye drops. In the evening, my eye started to feel better. The next day, my eye was fine. When I was a little bit older, I got contact lenses. Shortly after getting contact lenses, I woke up and my eye was painful and slightly red and swollen. I was concerned I might have an eye infection. I went to the eye doctor. The eye doctor looked at my eye and said it was episcleritis. Per my doctor's instructions, I did not put in my contact lenses that day. By the next morning, my eye was completely healed. I began wearing the contact lenses again. I got episcleritis a few more times. The eye doctor thought the contact lenses may be causing the episcleritis attacks. I then stopped wearing the contact lenses and erroneously thought I no longer had to worry about episcleritis. More time passed, and I continued to have these eye episodes 1 to 2 times a year. I did not go to the doctor because I thought it was viral pink eye. When I was at a large medical facility getting extensive testing done for my medical issues, my eye acted up. I went to my previously scheduled appointment with the doctor. When I told the physician about my eye, she was concerned it might be scleritis and said without treatment, scleritis can lead to vision loss. She immediately sent me to an eye specialist at the clinic. The eye specialist examined my eye. He told me it was my episclera which was affected. There was no reason for any concern. It should clear up on its own in 24 to 48 hours. He asked if I'd ever had one of these attacks before. I said I get them 1 to 2 times a year and have had them since I was a small child. The physician said he had other patients with connective tissue disease who get episcleritis episodes a few times a year. As a side note, I have a connective tissue disease as one of my diagnoses. The doctor thought that probably I've had episcleritis since I was a child. The doctor also told me I was very fortunate my pain was not more severe. He said when some of his patients get episcleritis, they need morphine to control the pain. The physician went on to say that if during one of my attacks, the pain and symptoms do not start improving within 24 hours, I should seek medical attention to make sure it is not something more serious, such as scleritis, which requires medical intervention. So there is a brief history of my experiences with episcleritis. Thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.